Ma'am, I think you are unmute. You are muted. You have to unmute yourself before talking.
हीरल मैम, योर वॉइस इज नॉट कमिंग. आपका आवाज नहीं सुनाई दे रहा है. खुशबू मैम, सॉरी, आपका आवाज नहीं सुनाई दे रहा है.
Okay. Good morning, everyone. A very warm welcome to all of you join us today for this webinar session. I am truly delighted to have the honor of introducing our distinguished guest speaker, Dr. Shreeram Hirlekar, sir. Dr. Shreeram Hirlekar, sir, is a BHMS PGDPC, DCP, Diploma in Child Psychology. He is HOD of the Department of Organon of Medicine at KES LADP Homeopathic Medical College, Vengulla, Maharashtra. He has a 21 year of teaching experience. He has completed Swara Gurukul teachers training program. He is practicing sensation method at Sri Vignaharta Homeo Clinic, Vengulla, Maharashtra. Today, sir, give us the knowledge about aphorism that helps us to prescribe the accurately medicine. So without further delay, please join me in extending a warm virtual welcome to Dr. Shreeram Hirlekar, sir. We are truly honored to have with us today. Welcome, sir.
Namaskar. Good morning to all.
Good morning, sir.
Yeah. Can I share my screen?
Okay.
Yes, sir, you can.
Okay.
Option is on.
Yeah. Now screen is visible.
Yes, sir.
Okay. So let's start. First of all, welcome to all the audience. I must be thankful to our Guru, Dr. Shekhar Algundgi, sir, for giving me this opportunity to share my experiences with this Vidhyadeep University students and budding homeopaths. I am very happy to know that nowadays homeopathy is having lot of scope in different types of diseases and disorders, and many students are interested in learning homeopathy and different methods. So when you are about to start your practice, what we should do, how to start it, and what basic things we should know. So I always congratulate such efforts. This time by Vidhyadeep University for students, they are making these things available for their students. So thankful to all those organizers. Let me start with my topic. Aphorisms that help us to prescribe accurately. One request to all audiences that please do not unmute yourself. It disturbs the lecture as well as the other audience. So keep this in mind. But if you have to ask any question, you can ask me at any point. And do not write that question in chat box. Either you can ask it or you can ask it at the end of the lecture, no problem. But If you have to ask question, then you can unmute yourself and then again mute. So do not forget this. Thank you. So as we have gone through the first year syllabus of Organon, we all know about ground plan of Organon. I'm not going to tell you here the same thing again because you have already learned it. And when I decided to go for this topic, then I gave a second thought and came to know that what I'm going to tell this time, because there is no single aphorism that is useless. This is the masterpiece of Dr. Samuel Hahnemann, that he has given us this unique system which is based on the law of similars and which is helpful for suffering of mankind. And do you know the last word by Dr. Hahnemann when he breathed his last? He said, I have not lived in vain. Similarly, whatever he has written in the Organon, those aphorisms, not a single aphorism is useless. All aphorisms are useful in this or that way to give us right medicine to our patients. So each and every aphorism is helpful, but we are going to learn few aphorisms of them and teaching in those aphorisms in today's lecture. So we will talk with the practical part only. Case taking is described from aphorism number 83 to 104. Almost 200 years back, this homeopathy was discovered, but still there is no only one ideal way of taking the case. So Dr. Hahnemann has initially given this sentence in the 6th edition of Organon that I will give you general guidelines. That means there is no fixed way. So still we are learning. Everyone is learning. I am also still learning that how to take case. And for that reason, I attend Swara Homeo Gurukul again and again. So case taking is an individualizing examination of a case of disease. Here, we are taking interview of the patient as well as we are examining the patient. Sometimes there is bad impression among the students of homeopathy that homeopathic doctor doesn't have to go for physical examination. It's completely wrong, I tell you. If you have this bad impression, then just remove it from your mind. Physical examination is equally important to assess the condition of pathology of the patient, to understand the diagnosis, and to know exactly what are the peculiar signs of the disease, if there is any sign present in the patient's case. But otherwise, we have to ask patient and get the symptoms. So mostly it is about symptoms, and those symptoms should be asked in such a way, should be gathered in such a way that will individualize the case. This is more important. So every case will be different from the previous one. And for that reason, we don't have to fix our ways. Some students I have seen that they go for a pro pharma and it is available in any college or even in our journals which we write, it is available. So up to some extent, it is helpful. But in all cases, if you do the same thing, it will be just mechanical work. And we are not here to do this mechanical work. So in this aphorism, Dr. Hahnemann has given that physician should have some qualities. Before taking the case, these are prerequisites. The first is unprejudiced mind. Freedom from prejudices. When we are about to take the case and patient is known to you, then there are many concepts come in mind while taking the case or before taking the case. We should deliberately keep these things away. Usually students ask me, then what to do when we are taking a case of our family members or relatives or friend? This is the first thing we should do. That those ideas which we know as a person, as a relative, from that person, we should just keep them apart. I know, but because everything we don't know. Unless we talk to that person, unless we have some understanding of his problem in depth, then only we can understand the problem and the disease as an individual disease. We may be knowing that person, but we are not knowing his way of perception. So to know his way of perception, we should be blank. We should be empty. And then it will make us a good homeopathic physician, a good listener. Otherwise, what will happen? That if I say, yes, I know this, yes, I know this, when you say, I know it, then the other person will not disclose properly. And then it will become big obstacle because you don't have complete information about it. I tell you, not only in case of case taking, but in our day-to-day conversation also, in casual conversation also, many a times this prejudiceness pops up and the thread of conversation goes away. And I tell you, there are a lot of problems related to relationship, related to relation between boss and the worker, relationship between different persons. There are many breakups, and many of them occur because of one sentence, I thought or I think. If you just remove this, I thought or I think like this, half of the problems will end. Because when you say I thought like this or I think it is like this, that means it is your idea. You have not observed the facts and you are going for observing the things with something premeditatively present in your mind. So just keep it apart. So you can simply say, I know, but I know this thing, but. So when you take a case and in the middle of the case, patient says, doctor, I have this joint pain. There is a lot of stiffness. And when I walk for 5 minutes, then I feel okay. Immediately Rustox comes in our mind. So what to do? Simply you say, tell yourself that I know Rustox for this complaint. But if it is a case of Rustox, just listen to the patient completely. If it is Rustox, it will come with other symptoms of Rustox. If it is not Rustox, it will come with some other symptoms of other remedy. Just keep patience and listen carefully. So this is about prejudiceness, how to overcome about it. The second thing is sound senses. When patient is giving its narration, our senses should be alert. And if our senses are alert, then we are able to note down many things which are not verbally told by the patient, but from his gesture, from his gait, from his facial expressions, we can note down. And for that, attention in observation is very, very important. And the last thing that Dr. Hanuman says, and our Shekhar sir also says, that fidelity in tracing the picture of disease. You should have confidence in the system, in the way that you are going with. If you are not confident about what you are doing, the front person will not be confident about you. So you should believe in yourself. You should believe in the system. You should believe in the way you are going for, and definitely it will work for you and your patient. So sound senses are equally important, but one thing is even more important. It's sixth, that is common sense. Never leave it. Even though information given by these five senses is collected, we have to analyze it with the help of common sense. And if we do not do it, that collected information will be of no use. It will land up in some different remedy which is not correct always. So case taking has three different stages. From aphorism number 84 onward, Dr. Hanuman has described its stages. First stage is described in aphorism 84. Here Dr. Hanuman says, when patient is narrating his complaints, physician has to listen carefully. Exact words are physician sees, hears, and remarks. So before giving any remark on your case paper, you should see, you should listen, and then you should write your remark. So while doing this, very important thing is let the patient talk voluntarily. So your mouth should be shut and your ear should be very alert. Then only it is possible to go through this first stage peacefully and comfortable. Many times what happens that when patient is talking, we are eager to ask our questions. Okay, tell me about this, tell me about that. What about your appetite? What about your thirst? What about your bowel movements? And so on. Because we are in a hurry to complete the proforma. So I tell you the first thing, that don't go for filling the proforma mechanically. Try to listen the patient. Patient has come to you to tell you something. Patient believes in you that you will relieve its suffering. So it is our duty to listen to the patient. When I was attending my psychology lectures, I wanted to tell you, these are the things they had given. How to respond. This was about a case of abuse. We also may get any case of abuse in our clinic. So this is not related to homeopathy, but how it is helpful. And I tell you, nowadays, this is going on in modern science. But 200 years back, Dr. Hanuman has already told it. See what they say. Listen. Do not interrupt. Pause. See, this pause is very, very important. When patient stops its narration in between, first confirm that really the patient has completed its narration, or patient is thinking and trying to collect the data, recall the data to tell something more. it will be seen from its facial expression. Simple thing. If patient is looking into your eyes, there is eye-to-eye contact, it's there, then definitely patient has completed his narration. But suppose if the patient is not looking at you, definitely he is thinking. He wants to say something and he is trying to collect the words. So take the pause. Do not interrupt. Do not ask too many questions, because asking question will disturb the train of thoughts. So in initial phase, asking too many questions to be avoided. Initially, you can reassure the patient that this is a process of case taking and we will give you exact remedy which will relieve your suffering. When a case of abuse or any adverse condition or shocking condition has happened and that has affected the patient, do not act like shocked. If such things are there, you should assure patient that I believe in you. Just be honest and tell everything. And I tell you, patient has come to you to relieve his suffering. So patient will not lie. Patient will tell you all the things because he wants relief. So be honest and tell the person that you cannot keep a secret, because whatever thing you may find, it is trifle, but it can be important for us to prescribe right remedy. So tell everything. And then only you will get help from us. So if you do not know who may help, get the help. So physician in our case is the person who can help you. So don't say that no one can help you. We are here to help. This type of assurance will give your patient a relief, and patient will be ready to tell you everything. So whenever you are taking a case, you can explain your way of questioning in 2-3 lines, because new patients do not know homeopathic way of questioning. If you go to allopathic doctors, they ask only few questions, they examine the patient and they prescribe. This is their technique. But we need too much information to collect data, collect symptoms, and then we can prescribe. So this is our way. And this way, all patients do not know. So it is good if you explain these questions, that the way you are asking question in just 2-3 lines, but do not counsel the patient. Because if you counsel the patient about his suffering and all, patient's problem, that inner things will get little diluted and will not come out with the same intensity which is already there, already boiling inside. So counseling should not be done before taking the complete case. So how to start the case? Simply, you can say, tell me what can I do for you? Our Shekhar sir says in workshop that speak as less as possible and listen as much as you can. So if you talk as less as possible, it will be better. So you can simply say, just tell me. In Hindi, if you want to say, boliye, bataiye. As patient has come to you voluntarily, patient is definitely ready to tell you everything about his disease. So you have to just give a start. Simply you can say, how can I help you? or what are your problems, or tell me about your problems. Important thing here is you have to just start the conversation. And in this, once you started this conversation, your duty is to observe the patient carefully. Because patient wants to convey so many things. Some patient will bring reports. There are 2-3 files. Many lab investigations, sonography, MRI, CT scan, X-ray. So many things are there. Lab investigation, blood investigations. If patient wants that you should see these reports, then only you have to see it. If patient is not interested in it, patient is interested in narrating complaints, then go for those complaints, listen to it. So in this first step of case taking, physician has to be completely passive, receptive, and receive the information from patient in whatever way patient wants to tell. In this case, we should not be active participant. Even though conversation is one-to-one, but you are only a listener. And if patient has come with relatives or friends, then you should be cautious about it. I tell you what I do. In my new clinic, I have kept only one chair in front of me because patients do not disclose all the things in front of relatives. Just 2 days back, a patient came to me. She gave a complete case. She came with her son and she was almost 55 years old. I prescribed medicine for her. She went out with medicine. After 2 minutes, she came back and she told doctor, when can I call you? I said, for what? She said, doctor, I have to tell you something, but I will tell you on phone call. I suddenly clicked that she was accompanying with her son and she didn't want to disclose few things in front of her, in front of him. So she's saying that when can I call you? So I gave her time, and when I listened to her, whatever she told in the case taking process, she told many more things on phone call afterwards. So this can happen with you. So as far as possible, keep only patient in your cabin and keep all his relatives, attendants outside whenever possible. And if you are male and patient is female, then sometimes it becomes a problem or vice versa. But otherwise, keep only patient because patient's relatives have bad habit to disturb in between by interrupting the patient. And you can listen to one person carefully, not 2-3 persons. So this is very important. Another thing, patient's relative want to say something. Then what to do? So usually what I do is, if patient's relative are insisting on telling something, then I ask them to come first inside and tell whatever they want to tell. Because you should respect their ego. You should respect their will. And once you respect them, they will tell you everything. Tell them, let me see patient later. Whatever you want to say, you just say first. I will listen to you first and then I will listen to the patient. so that they get satisfied. They will tell you whatever they want to tell about patient, and then you start your case with your patient. This will help you to get more information from the relative, as well as afterwards during case taking process, these relatives will not interfere. And if any more information other relatives want to tell, you can ask them. After case, I will listen to you. You can get those information, those symptoms, because Dr. Animan has also given instruction that you should talk to relatives and attendants to get more data. But while taking the case, there should be one-to-one conversation only. This is very, very important. Is there any doubt about this? Please feel free to ask. Okay. So when case taking starts, initial 10 to 15 minutes are very important. Because when patient comes to you and starts talking about his problems, they will tell you about so many things. And if you are alert in listening these things, then you will get many ideas about case in first 10 to 15 minutes. Because it will tell you what are problems of the patient. Sometimes patient may come with one single problem. Sometimes patient may have multiple, 4, 5, 6 problems. What kind of person he or she is, that also you will come to know from the initial talk of the patient. Some patients are introvert. They will talk very less. So you have to ask too many questions for such patient, and they will answer only one liner. In one sentence, they will answer your question, only to the point. So in such cases, you have to ask too many questions. Some people are very talkative. They will not let you ask question even. So at least for first 10 to 15 minutes, you do not ask any question. Let them get empty. Let them tell whatever they want to tell voluntarily. And these 15 minutes will tell you how long this case will go. What can be the diagnosis of this case? What can be the prognosis of this case? So many things about the case will get clear to you, and you will get idea that how to approach to this case. Because every case will go in a different way. Not all cases are similar. So in which areas this patient has problem? Once you note it down, then you can approach to the patient in those areas. So which areas need to be explored will be clear to you in initial talk of the patient. And this is the first step. So these are the types of patient that Dr. Animan has described in different aphorisms. That some patients are indolent, either because of false modesty or because of their basic nature. They are introvert by nature. Say they do not talk much. Others are hypochondriac patient. And hypochondriac patients will tell you they are suffering in exaggerated form. And you will get confused that really this patient is suffering this so much or not. So Dr. Animan has given instruction to treat such cases that in one interview you will not understand the intensity of patient's complaint. But when you will inquire about patient's complaint in follow-up, then you will come to know that they don't know which complaint was told with too much intensity in the last interview. Because this is their inborn tendency, inner tendency, that to exaggerate the things. Because sometimes patients feel that when they will exaggerate their symptoms, physician will pay more attention to them and will give some magical remedy to cure them as fast as possible. This is their idea. So they will exaggerate anything and they do not remember what they had told in exaggerated way. So if you compare the two interviews, you will come to know exactly what is the intensity of their complaint. Because at one point they will exaggerate one symptom, at another time they will exaggerate another symptom. Another type of patient that you will get will be patients coming after taking another treatment. Nowadays, mostly allopathic treatment, or some patient come after Ayurvedic treatment also. If you know about allopathic drugs and their interactions and their effects, then it is well and good. And if not, nowadays, Google is there. You can Google everything, any drug content, and you will get all the information available in your mobile or laptop on internet. So what instruction Dr. Hahnemann has given is, whatever drugs that patient has received before, in case of chronic diseases, effects of this drug will mask the true picture of disease. And to avoid wrong prescription, you should ask the patient to stop those drugs for some time. Now listen, this instruction was given almost 200 years back. Nowadays, there are many things have changed. If you follow this instruction word to word, it may cause problem. Because suppose there is a patient who is on anti-diabetic medicines, anti-hypertensive drugs, or patient is in grave condition and is given steroids. You cannot stop those drugs immediately. So for that, you should know how to tackle this problem. So don't take this instruction by its direct meaning. It is not applicable for such patients. So these exceptions you should remember. So if those drugs are causing too much problem, then you can ask to stop. Otherwise, patient has come to you and still he is taking drug. That means those drugs are not giving him relief. So if you can continue those drugs and still you give medicine, and if patient finds relief, that will be definitely because of your medicine, because already patient was taking the previous drugs. This also can happen. And in case of chronic diseases, Dr. Hahnemann told you can give placebo and wait for a few days so that the effects and the symptoms of the previous drug will disappear, and then the true picture of the disease will be perceptible in patient. But in case of acute condition, you cannot try this method because there is no time for that. In such condition, simply you have to take all the symptoms present and you have to prescribe on those symptoms without stopping drug, without giving placebo in between. So giving placebo is possible in case of long-running chronic diseases, not in case of acute diseases. Please remember this. Other type of patient will come like epidemic cases. Just few years back, there was COVID-19. And you must have seen so many cases suffering from almost similar symptoms. I say almost similar, not exactly similar. Because if you go through proper case taking, you can find even in epidemic cases, there are some peculiarities which are there in one person but absent in another person, another many person. So in such cases, genus epidemicus may work. But before deciding genus epidemicus, we should see, Dr. Kent says at least 20-25 cases you should see without considering that this is an epidemic, without considering that all cases are same. Once you say all cases are same, that means you become prejudiced and you fix your idea about the remedies. We should not do that. That will end up in failure. In case of epidemic cases also, the method of case taking will not change. It will go in the same way. But we should collect the data from each patient and make segregation. So each symptom related to particular organ, for example, if COVID is there, so symptoms of respiratory system of all patients we should collect, then symptoms of gastrointestinal system, symptoms of mind, and as per the Hahnemann schema, from head to foot, all the symptoms should be gathered. And then we are able to find out genus epidemicus. When the initial narration of the patient is complete, then we can go for the second step. Stage 2, the complete whatever is incomplete. When patient is talking voluntarily and we are not asking any question, as we already know that patients do not know homeopathic method of case taking. So they don't know what to tell, what is required for you as a physician. So they will tell according to their own accord, according to their own opinion. So you have to take it down everything. But in second step, you should ask about that each symptom you have noted and complete the other attributes of that symptom in relation to location, sensation, modalities, and concomitant if present. This is our way of completing the symptom. So patient might have told you incomplete things. Now it is physician's duty to take complete symptom by asking further questions about it. These questions could be small. For example, when patient tells about migraine, we know that in case of migraine, mostly there is a temporal headache. Mostly it is one-sided. But we should ask the patient, if patient has not clearly mentioned like this, then in which part of the head you get pain, then patient will tell you whatever is happening with the patient. For example, patient may say, doctor, my this side pains more. Some patient may say, doctor, sometimes right side, sometimes left side. Some patient may say, doctor, my occipital part, back part of my head is painful. Or my neck is painful and the upper part of the neck and lower part of the head is painful. There can be different varieties. So don't fix your ideas that if this is the diagnosis, then this can be the symptom. So ask openly and you will get exact symptom. And when we ask again and again, patient will provide you more details. So पूछने में क्या जाता है? Do not hesitate to ask. Sometimes we feel what will happen, what patient will think that if we ask the same question again. If we are not clear with our ideas that what exactly is happening with the patient, then do not hesitate to ask. Ask the patient, क्या होता है? कैसे होता है? किस तरह से होता है? The same question, if you don't want to repeat again, then you can ask the same thing in different words. This is the idea of conversation. If you make the conversation well, patient will tell you everything because patient has come to you to tell you everything. So no hesitation, especially when there are sad incidences. Something has happened in the life of the patient. So how to ask? This will be a modesty on your part. Just keep it apart. Many of the homeopaths, at the beginning or even after a few years also, do not ask about the sexual sphere of the patient. Especially when the opposite gender patient is there. It looks odd. But actually, if patient suffering is there, patient will not always tell you these things. So it will be our duty to ask. पूछने में क्या जाता है? अगर कुछ रहेगा तो बोलेगा, अगर नहीं रहेगा तो नहीं बोलेगा, right? But if you don't ask and if you miss any more important symptom, then it will be loss for us to select the remedy. So in second step, we have to go to each and every symptom that patient has told in the first stage and get it completed with regard to its location, sensation, modalities, and if present, then concomitant. What it will give us? It will give us clear idea about pathology. It will give us clear idea about physical generals. It will give us clear idea about what exactly is happening with the patient. If you know the levels of experience, then you can say this is level 1 and 2. Level 1 is name, level 2 is facts. And sometimes level 3 will also come. That is levels of emotions and feelings. So these things will give us idea that even though patient doesn't go ahead in the higher levels of experience, then also on the basis of these complete symptoms, you can prescribe remedy. Because before taking the case, we never know that at what level patient will go, at what level patient is living. So if we complete this data, we will have some basis for prescription. And after that, if patient goes to the levels of delusion, sensation, energy, it will be better than the best. But if not, we will have this information which we can use with the help of Matra Medica to prescribe right remedy. So from the second step or the second stage, we have to complete our data from the patient so that we can get idea about his disease and his different areas where we have to go in details and which are not covered by the patient. And that will be step 3. It is given in aphorism number 89. You should ask more details and some special questions. And you have to ask about those areas which are not voluntarily told by the patient. For example, if patient comes to you for the case of complaint of knee pain, patient may not tell you dreams. Patient will not tell you about stress and strain. Patient will not tell you about, if patient is strain, will not tell you about menses, even though there can be any problem. So in this third step, we have to go in those areas which are not covered by the patient. The information is not given by the patient, but don't be under wrong impression that patient has not told, that means there will be no complaint. Again, this is a prejudice. Again, I will tell you the same thing. पूछने में क्या जाता है? So if the picture is not clear, picture will get more clear. We will get more peculiar symptoms. And these peculiar symptoms will help us to select the remedy finally. So go in those areas which are not covered by the patient. So remember which areas we have to go. Because all patients do not have dreams. If you ask them, they will simply say, Doctor, I don't have dreams. Or they will say, I don't remember dreams. So all patients do not give you exact sensations. So we should have some tacts to get those sensations clear. All patients do not do doodle. I tell you one incident that few of my students went to Dr. Shankaran sir's seminar in Mumbai, and Shankaran sir had given demonstration about how doodles can help to select the medicine. And after attending that seminar, they started asking each and every patient to draw doodle. And afterwards, they came to me and said, Sir, patients' complaints are something different, some different sensation is coming, and in doodle something different is coming. What to do? See, these are the tools. But when to use this tool is the important knowledge. Without getting complete knowledge, if you use any tool, that tool will be useless. It will not work. Even though it is a good tool, it will not work for you. So most important thing is, do not push your patient in the area where that patient doesn't want to be. So using doodle is not at all a bad thing. But in which patient it is to be used and which patient it should not be used, there are some ideas behind. And if you learn those ideas, then only you will be able to use these tools properly in appropriate patient, and definitely you will get result. Just you know this, so don't ask each and every person to do that. The same thing is about hand gestures. Hand gestures are casually made by persons, and sometimes they are part of the case, part of the sensation. How to differentiate it? At what level of experience the patient is talking is much more important. And when the patient's hand gestures and the words are aligned, then definitely you should go with the words what patient is talking about and just keep apart those hand gestures. But when patient's gestures are talking something different and words are talking something different, then definitely you should try to understand what is the meaning of their gesture. Again, simple thing, just ask them to describe. They will tell you everything. But do not push the patient too harshly. Otherwise, they will come back to the fact level and then you will get nothing from it. Or whatever they will say will not be significant for us to prescribe. So we are now going with a case. I will show you a case, an acute case from my clinic. A lady of almost 55 years old came with her husband, and the case went like this. So I asked her, please tell me. And she said, doctor, I have cough at night. It's a dry cough. There is no expectoration during night time, but mucus comes out during daytime. When I cough in daytime, there is mucus coming out. But at night, there is only dry cough. It disturbs my sleep. I must wake up and sit up. I get restless, अस्वस्थ होती हूँ. And I feel like I will not have sleep this night. See, this is the narration of the patient. Now, I am going to ask you, how will you proceed in this case? And which question you will ask ahead? Please type in the chat box. Or you can unmute yourself and answer. What question you will ask the next? See, in such cases, we should not hurry to ask question. First, see by watching the face of patient that patient has completed the narration. If patient has completed narration, then just give a push, because this is initial part of the case where asking question is not good. Because when you ask question, you give some direction to the patient. Here we are not clear with exactly what problem patient has. Patient is talking about cough. These are some particular symptoms, but these are fact level symptoms. So try to understand those facts little more in more detail so that there should be some base created for us. So simply do not ask any question. I said little more. See, in my mind, there was my intention that she should talk about cough. So in bracket, I have written this, about cough. But I didn't utter it. This is the technique that we have learned in Swara workshop from Shekhar sir. That speak as less as possible is one thing. And second thing, your question should be as broad as possible. Don't make a narrow choice. Here, if I would have said that little more about cough, so patient could have talked about cough. Maybe or may not be. But when you say little more, or thoda batao, so patient is ready to tell anything because this is not pointed towards cough, na? It is pointed towards person. Thoda aur batao. Patient is ready to tell anything. Patient has this option. So keep your question as broad as possible. It should be not a leading question. This is the instruction given by Hahnemann in aphorism also. So then patient said, in daytime, it is much less and mucus comes out and then I find relief. So जब दिन में ये कफ होता है तो बलगम आता है, अब जब मैं वो एक्सपेक्टोरेट करती हूँ तो मुझे रिलीफ मिलता है. But at night, when I lie down in bed and cough starts, I get irritated. I can't sleep. I feel restless. Now see here. I just asked to describe more and what new things have come in this case, that more detail of the complaint has come. And one more thing she added, that she can't sleep, she feels restless, and another thing that she told is she gets irritated. So if you ask more general question, I tell you with guarantee that more particular will come. So then I ask about this restlessness, because this is the thing that we have to understand. Restlessness means अस्वस्थ हो जाती हूँ. This is what exactly happens. So I asked, restless? So patient said, yeah, I feel something strange is happening to me, like loss of strength. I feel like there will be no sleep, and actually I don't sleep. Restless means it is not बेचैनी, ये बेचैनी नहीं है. See, patient is voluntarily denying कि ये बेचैनी नहीं है. So it strikes my mind. अगर ये बेचैनी नहीं है तो क्या है? Is one question. And another thing, if this is not बेचैनी, then बेचैनी is something different and that patient knows it. So let's go for this. So I asked, what is बेचैनी? ये बेचैनी क्या होती है? And then patient laughs and takes a pause. So as she is not talking too much, so husband started telling something. So I stop her with just hand gesture and ask him not to talk. Now let her talk. Then after some pause, she's told that it is difficult to tell. I said, okay, but just try and tell me whatever will come to you. Again, she took a pause. Then again, there was no dialogue, so husband tried to interrupt it. Again, I stopped the husband. This is the thing I tell you. Because of these reasons, I do not allow the relatives of the patient to enter the clinic while taking the case. Because if patient is connecting something to its inner voice, other people do not allow it to do. And what we want is that inner thing should come out. That inner turmoil should come out. And she simply said, it may be psychological. Now see, patient knows that it is not related to only physical complaint. There is some psychological part is there. So I asked meaning, matlab, and patient said, when any incident happens, what will be the outcome like that? No psychological trouble as such. But when there is any incidence occurs, thoughts come in mind. Now see this narration. She is telling something vaguely, which is not pinpoint, which is not exactly telling any incidence, but it indicates that something has to be there. In the back of mind, she is thinking something. In the back of mind, there is something which is not ready to come out. But once you know that there is something, you should use all your tools to come to know about it. Take it out by hook or crook, because that will be the area will give you most keynote symptoms of the case. So I just simply ask, what kind of thoughts? And she said, what will be the outcome ahead? It will be good only, but still thoughts come to mind. Now see, she is trying to rationalize. This is one of the way of patient's expression. Sometimes patient will tell you the things in relation to themselves. Sometimes patient will speak about something and they will rationalize it. They will try to show that how it is correct in logical way. Or sometimes patient will tell you something by projecting the things on other persons or other things. These different ways of narration of the patient, if we understand, accordingly, we can ask our question. And if we ask appropriate question, definitely patient will go to the next level and more information will come out. So here she was talking about, again, vague things, but there are some thoughts in her mind. And her problem is about what will be the outcome. So I asked, what's your idea? What will be the outcome? And then she said, when you think many more questions come to your mind, it has no meaning. Again, she is rationalizing that these questions have no meaning, but still she has those questions. So we have to understand what questions are making problem for her. So I asked, what kind of questions? Patient again took some pause. And then she said, not troublesome. About family. See, still she is not ready to tell what questions that she gets. So I gave a little push again. What kind of? She said about family. Na? So what kind of question is silent? And then she started telling about children. Means no bad thoughts. When something happens, then I feel it should not happen. Only good things should happen. See, again, from this narration, she is giving vague idea but not telling any particular incidents, not telling any particular feeling, not telling any particular sensation or even emotion also. This type of cases you will find in day-to-day practice. If you ask proper question, then only correct information will come out and we will reach to the right remedy. So in this case, I asked what can be bad, because I wanted to know what is bad for her. Again, she was rationally denying the things that she said there is nothing bad, only our mind thinks in that way. She means to say that thoughts are bad. So what mind thinks that there can be a possibility of bad may happen. This is just imagination. Nothing is real, nothing is there in the reality. But her imagination is that something bad will be there. But still she is not ready to tell that. So the next question. What way mind thinks about bad thoughts? Again, she took a long pause and said nothing. So when she is not ready to tell about herself, we have to become even more generalized and should ask about any XYZ person. So I ask, how anyone can think bad? She is again rationalizing. It depends upon situation. She means to say, every situation will be different for different person. This is logical and intellectual answer. So we have to go ahead of it. So I asked, give me one or two examples so that I can understand. Then she said, when someone is sick, especially my grandson is sick, then I get bad thoughts. I imagine, and she stopped it. So I asked, please tell me your 2-3 imaginations. When her grandson is sick, she gets those bad thoughts. And those are only thoughts, not reality. She is just imagining. So we have to understand her imagination. Actually, mind should stop. Mind should not think like that. Again, she is rationalizing. But our mind thinks, na? मन में ख्याल तो आते ही हैं. And then anxiety starts. Now you got it? She has that problem of anxiety due to imagination. Again, she is telling there is no big reason. I know it's not good to think in this way. It gives trouble to ourselves only. ये सब करने से अपने आप को ही दुख होता है. This is what she said. But again, she gave only hint about her anxiety. So I asked, in what way troubles ourselves? And then she said, physically and mentally. How? Continuous thoughts on same thing causes tension. So what kind of tension? It's not bad but intensity of thought goes on increasing. The intensity of thought goes on increasing. Then I counsel to myself and get calm. Now still we are not clear with the problem, but we are unfolding small things. Even though this is an acute case, we should not make hurry. We should not try to push our patient in some direction. It will go in the wrong direction, definitely. So always go the way with the pace of patient. And that's why initial part of the case is more important to understand what kind of patient in front of us right now. And according to patient's nature, according to patient's way of narration, we should decide what way we should approach with this case. Sometimes a chronic case may get solved in 15 or 20 minutes. And sometimes you may have to wait for 1 to 1.5 hours. In both types of patient, it may be talkative patient also, or it may be less talkative patient also. Both may take long time. So sometimes when I give appointment to the next patient has already come to the clinic, then I tell my assistant to take the follow-up that another patient, but do not disturb me for this case. That initial part will tell me that how long this case will go, in what way this case will go. And you should give your 100% and keep patience. And that's why Shekhar sir has taught us P formula. And the first P we should have is patience. And if this patience we have, then definitely we will reach to the right destination. Along with patience, there has to be persistence. We should not be persistent at wrong time, at wrong occasion, at wrong place. But at right place, we should be persistent. So in this case, patient is slowly unfolding her inner turmoil. So we should also go with the same pace. If we try to make a hurry, then it will spoil the case. So let it come out in its own intensity, with its own pace, and go with the flow. So then I asked her, what makes you worry so much? And then she started telling, Dr. C, now we both are aged. We are dependent on our children. So they should be in good condition. Otherwise, who will look after us? Again, I asked, matlab? Because these are, again, vague things. I have not understood what she exactly wants to say from all these. Because these are facts, na, that these both husband and wife are aged. Now they are dependent on their children. But for what? We don't know. Patient has not yet told. So when we listen to the patient, in our case paper, we should make mark that what should be the next question we have to ask. Otherwise, when patient's narration will end, And if we are not ready with our question, then it will become confusion for us exactly what to ask. And then in a hurry, because from inside we will think that if we do not ask question, what the patient will think. So we ask any question and then the problem starts. So writing down all the things which are important things is must. Our Shekhar sir says that we should write each and every word narrated by the patient, because we never know which words or which sentence will be helpful afterwards. But practically, I agree that initially it is not possible to write all the things. So write at least whatever is important part of the narration. Dr. Animan has given the same thing. We should write down important part of the narration. Not all words, but at least important words, so that when we have to ask further question, our appropriate question will be ready. So what is the intention of the patient behind telling this? What are the patient's idea behind this narration? That we have to understand. So we are depend on our children. So theme of dependency has come out. So make a mark, a theme of dependency. I have made this on my case paper. But again, the question comes, dependent for what? That is not told by patient here. So we can ask this. But instead of asking dependent for what, you can simply ask meaning, because this is more broad question. It is indicating towards that dependency. It is indicating towards that good condition. It is indicating towards this question that who will look after us. Because patient has not gave us a clear picture of the thing that what she is worried about. So simply asking meaning will take us to the further information. And see what she said. My husband has undergone bypass surgery. He is on medicine. I have some minor complaints. So we both are sick often, and all expenses are spent by my sons. If they are not earning well, then anxiety starts. Now, have you got some idea what bad thoughts she is thinking about? It is not completely clear yet, but still the area we have come across. The area is money. She has anxiety about how to make these expenses. So we have to go ahead and ask about it. Again, the question was about what? See, if you ask a particular question, you will get intellectual answer. But if you ask more broad question, you will get pinpoint answer. And see, patient said, डॉक्टर, मेडिसिन खरीदने के लिए तो पैसे की जरूरत होती है ना. सो इनकी दवाइयाँ खरीदनी हो तो पैसा चाहिए होता है. If my sons are not earning well, then what to do? So अगर बच्चे कमाएंगे नहीं तो ये खर्चा कहां से होगा? This is her problem. This is her worry. This is her imagination. These are her thoughts. And this came slowly by unfolding the story with broad question, with open-ended question. Now you will get picture clear for you. So can anybody tell me what are the symptoms we should take in this case? What should be the totality? And what can be the remedy? Please give your opinion. Now it is open to you. Now it's time for you to discuss. It should not be a one-way talk. It will be of no use. Yeah. I request all the participants to give your suggestions. I agree with you that it may go wrong, but do not hesitate because this is a learning point. I tell you, failure is the first step of success. Don't think that what others will say, this thought will keep you behind. It doesn't matter your medicine goes wrong here. Your choice of medicine, your suggestion goes wrong here, no problem. But when you will prescribe for your patient, it should not go wrong. So if it will be good, then it's okay. But if it is not a right remedy or if it is not a right suggestion, then make it corrected over here only. And this is the aim of keeping these lectures for you. Anxiety about finances. Jannavi, very good. Any other? What totality we should take from this case? Actually, by mistake, I had shown you the last slide, but you might not have seen it properly. I will be more happy if more participants share their views. Or if you want to ask any question, please feel free to ask. Okay, let me share next slide so that now you can talk about medicine. Now these are 6 symptoms I took. Cough, dry, night, and loose by day. Cough, sleep, wakens from. Cough, lying, aggravate, lying only on. Cough, sit up, must. Anxiety, health about. Anxiety, others for. And there can be one more, that anxiety about finances. So if you want to go back, I will show you the first slide, then you will come to know that these are the narrations by patient, where patient told the symptoms. See, I have cough at night, it's dry cough, no expectoration, mucus comes out during daytime, it disturbs my sleep, I must wake up and sit up. I get restless. I feel like I will not have sleep this night. Now see, from this very first narration, there are many particular symptoms have come. And that's why I told you that initial 10-15 minutes, the initial narration of the patient, the first stage of the case is very, very important. And you should be alert enough to note down all these things. And that's why Dr. Animan has given instruction that we should instruct our patient to talk slowly, with slow pace. You can simply tell your patient that I want to write down all your symptoms because I cannot remember all the things. So please speak slowly so that I can write down. You can just request humbly and patient will cooperate with you. No problem. And you will not miss any symptom. So now, what can be the remedy? See, when I repertorize this case from complete repertory, I got causticum, phosphorus, arsenicum, heparsulf, sulfur, conium, and hyoscyamus. Now, the question is, which medicine is to be prescribed? Because all these remedies have covered many symptoms of the case. If you are final year student or you are passed out, then it will be easy for you to know about repertory. Nowadays, computer repertories are available or some apps are available, so you can repertorize the symptom. But again, homeopathy is an art and science. And the art is picking up the right symptoms. Because repertory is the index of symptoms. Whatever you will give input, accordingly the output will come. It will be not a mistake of repertory. And that's why it is said that repertory is the mean and not an end in itself. Even though you repertorize the symptom, it will not always give you the one choice. Even though we follow the law of simplex, that is single remedy at a time for the given case. But repertory will give you all the possibilities that whatever data of symptoms you have provided. So repertory is not a final court. For final court, we have to learn materia medica. And learning materia medica will give you idea about keynote symptoms or definite pictures of particular remedy. Here in this case, causticum is coming as the remedy covering all the symptoms. But phosphorus, arsenic, hepar, and sulfur also coming, only one symptom is less. And this is not a mathematical calculation, it should not be that only the first remedy is to be given. Then how to select remedy? Because these are the things we have to learn. Repertorization also should not be mechanical. And when we know all the distinct features, the unique features of each remedy, we are able to differentiate on the basis of Matra Medica, on the basis of remedy understanding. If you know the kingdom classification, you will find here remedies of two kingdoms are coming prominently. First is mineral kingdom, causticum, phosphorus, arsenic, hepar, and sulfur. 5 remedies from minerals, conium and hyoscyamus from plant. So when we take the case, our aim should be to differentiate what is the kingdom in the case. In this case, you will not prominently find the kingdom idea which is coming out. But when you go through detailed chronic case, our aim should be to differentiate the kingdom first, then the subkingdom, and then the remedy. So when it is about plants, plants have to do with sensitivity. Plants are always sensitive to the things happening around them. And minerals have to do with structure, relationship, something lacking or something losing. And when all these things are coming together, then in which area the problem is. Now here I give you clue that this patient requires some mineral remedy. Now what will be your suggestion? I am expecting your answers so that I can proceed. Or if you don't want to answer, it's okay. But please ask your questions from whatever understanding you get from today's lecture. It should be interactive, two-way session. Otherwise, it will be of no use. And you have learned that dare to be wise. Dr. Animan has given us this idea, dare to be wise. So dare to ask, dare to learn, dare to know more. Okay? One suggestion has come, it could be arsenic. Then two questions will arise. Why arsenic? And second will be why not other drugs like causticum and phosphorus? But it's a good attempt that you have given answer at least. Any other suggestion? See here, causticum, phosphorus, arsenic, and then hepar sulfur and sulfur are coming. When we have to select any medicine in such condition, if one medicine is coming prominently and other medicines are not covering keynote symptom, then it is easy for us to prescribe the remedy. But when the situation comes like this, that only one or two differences are there and we have to select the right one, then we have to take help of Materia Medica. And to understand Materia Medica, kingdom approach is the best approach. That is what I feel because I go with it and I have got lot of success with that approach. So first we have to differentiate which kingdom this patient belongs to, this case belongs to. And I have given you clue that this is a mineral case. So to understanding mineral remedies, Dr. Jan Schalton has given the concept of periodic table and understanding of homeopathic remedies. Dr. Rajan Shankaran sir has written book, The Structure, which has 2 volumes. And he has given more details about this idea. And these ideas will help us to know the characteristic features of each remedy and how to differentiate the remedies. Because in periodic table, there are rows and columns, and each row and each column has specific issue. I tell you in short that the row 1 has to do with existence. Row 2 has to do with separation. Row 3 has to do with identity. Row 4 is about security, daily work, task, routine. Row 5 has to do with creativity. Row 6 is about responsibility. And in this case, patient was talking about only routine things, and mostly her delusion, her imagination, or her anxiety was about finances. This is a row 4 issue. So if you see these 5 remedies, causticum is from Kali group, so it comes in the 4th row. Arsenic album also comes from the 4th row. And hypersulf is also hypersulfuris calcareum. So calcarea is there. That also comes from the 4th row. So now these 3 remedies are there. Again, we are narrowing our search, but if we come across many remedies from the same row, then we have to go on differentiation on the basis of their column issues. So column 1 is completely dependent. Column 2 is dependent when required, when there is adverse situation. And if you look for arsenic, arsenic is in the 15th row. And issue of 15th row is I am losing what I have. So anxiety starts for losing the things. And column 1 and column 2, in case of 4th row, it will be Kali and Calcarea. They have issue of I am not having or I am lacking, so I am dependent. And patient has clearly told us that we are dependent on children. For what? For everything. And all the time. Not only in adverse situation, but all the time now, because we are aged, now we are dependent on our children and they should earn well. Then only we will be happy. Then we will be secured. She didn't use the word secured as such, but she, when was talking about finances, this is a kind of financial security. And this financial security, she was lacking. So in this case, the remedy will come up, will be causticum. And I tell you, when I gave causticum to her, in next 3 to 4 days, she was completely relieved of her cough. If you ask me what was the diagnosis, I can simply say it was allergic type of cough. There was no infectious role, and patient had already taken allopathic treatment for many days, including antibiotic and all, but still that cough was not subsiding. But when the right remedy was prescribed, it helped the patient to relieve completely from the cough. And this is the magic of homeopathy. If you take the case properly, you can select the remedy proper. So it is important for us to know that what are the skills and the techniques to be used in taking the case. And I tell you, these case-taking aphorisms will help us to get the proper data. And then the further aphorism will also help us. Aphorism which will discuss about the dosage, different scales, including centesimal scale and 50 millisimal scale. Definitely 50 millisimal scale also has a role in some cases where there is gross pathology and continuous problem going on, where you can use LM potencies. There are aphorisms which will give you idea about mental diseases. 4 types of different mental diseases Dr. Hahnemann has described. And you will find nowadays there are so many patients come with psychosomatic diseases. In today's world, you will find every 2 people out of 10 will tell you they have hyperacidity. Actually, there is no problem like whatever gastritis, acute or chronic, has the causes. But this could be because of emotional or mental stress, not physical, but mental stress mostly. Today's life is too fast and habits of the people have become too much sedentary. And these things are causing more rise to psychosomatic diseases. So if we learn those aphorisms, we can understand how to tackle with patients of mental diseases or psychosomatic diseases. Another aphorisms are there which will give you idea about one-sided diseases. Dr. Hahnemann meant by one-sided diseases simply means the diseases with few symptoms. At that time, mental diseases were included in one-sided diseases. Nowadays, if you explore these things, you will get more complaints, more detailed idea, and you can prescribe correctly. At that time, it was difficult to trace the mental picture of the patient. Nowadays, that condition is not there. We are much advanced or rather we are prescribing mainly on the mental symptoms and we get good results. Idea about local diseases and local applications also, Dr. Hahnemann has given that when there are diseases not disturbing the vital force dynamically, you can apply local applications like injuries. But when the disease is dynamic and if you apply anything locally, it will suppress the disease. Instead of curing, it will cause suppression. So when to use local applications and when not to use, clear-cut idea is given. And another most important area Dr. Hahnemann has covered in the last few aphorisms of Organon is about accessory management of the cases. Auxiliary mode of treatment it is called as. It is described about massage, mesmerism, positive, negative passes. At the same time, the instructions about diet and regimen. Nowadays, you will find many of the problems arise because of bad lifestyle, bad habits, bad regimen, and dietary habits have also changed. If we can make corrections in those things, it will help us, our patient, to recover fast. So instructions about diet and regimen are equally important after prescribing the right remedy. And when we do all these things together, not only prescribing the remedy, but doing all these things together, it will give your patient relief faster, and you will find that happiness that you have done something good for the humanity. So now it is up to you. If you have any questions, any queries, feel free to ask. So I hope here that you have got something from these lectures. You will get idea how to approach the case, how to begin the case. So here when my lecture ends, your journey of taking cases begins. I know this journey is too long, but Dr. Hahnemann's aphorisms, the Organon, will help you on each and every step of this journey and will correct you whenever it required, will help you to serve for the suffering humanity. One more suggestion I want to give you, that when I was doing my practice, I was having some success, but some failure also. For taking these cases, when I attended Swara Homeo Gurukul workshop, where Shekhar sir gives lectures personally in Konkan, 7 days workshop, it is always 1 week workshop. Most important thing I learned from him is case taking techniques. And I used to make my notes, and those notes are now useful for me in my clinic. But now Shekhar sir has published a book on case taking, and I recommend you all that if you get that book and read it once, twice, thrice, each and everything about case taking is described there. I think nothing will remain to learn beyond that. So it is a must for every homeopath. Thank you, ma'am. This is the book. And this book is now available with 15% discount. And I think this book is million worth. So don't look at the what price it is. This is not a book like a novel or any story that you can read once and keep aside. Each and every page you have to read twice, thrice. And every time you will read it, you will get new insight about different patients. If you are already taking cases, already you are practicing, you will come to know what mistakes you might have done in your cases. And if you are a student, you will never fail if you follow these instructions given by Shekhar sir in this book. So I recommend it to each and every student. It should be in your hand, on your tabletop, that this book is to be there. This is the guiding path for variety of cases. Nowadays, the word guarantee is prominently used. It's in politics. I don't want to go in that, but I tell you, this is my guarantee that if you go through this book, definitely many problems of case taking will get solved, and you will be able to take a nice case which will lead you to the right remedy. Thank you. I must say thanks a ton to our Guru Shekhar sir for giving me this opportunity to share my thoughts with you, as well as to the dignitaries of Vidhyadeep University for arranging this for the students and making them these facilities available, because whatever you read in your books, that has been written many years back. What is happening nowadays? So they are trying to update you all students. So take help of these opportunities, use these opportunities to expand your horizons of knowledge. Thank you all.
Thank you, sir, giving us such a valuable knowledge. Thank you.
Can we end meeting over here?
Okay, sir.
Okay, thank you.